Nutrition for diabetes. Diabetes is a disorder in which blood sugar levels are consistently higher than normal. This is a silent killer disease that progresses slowly but leaves very serious consequences: stroke, blindness, heart attack, kidney failure, amputation. Diet is the most important issue in the treatment of diabetes, with the aim to ensure an adequate and balanced supply of both quantity and quality of nutritional components to be able to well regulate blood sugar, maintaining the desired weight to ensure that the patient is healthy enough to function and work in accordance with each individual. Therefore, how to eat in the right way and with enough nutrition is a matter of concern for people with diabetes. Benefits of the diet. A reasonable diet will help stabilize blood sugar after eating, protect the heart, control blood pressure, blood fat, avoid hypoglycemia for people taking drugs at risk of hypoglycemia, lose and maintain your best weight. Help patients maintain daily physical activity. So what is the right way to eat? Should eat at the right time, right meal of the day, morning, noon, afternoon. Should not eat many small meals or snacks. Do not eat too little. Do not skip meals, eat slowly, chew well. Eat just enough to your body's needs. Avoid preparing stews, purees, fried, baked, because the smaller the size of the ingredients, the higher its glycemic index, so eat simple dishes, steamed, boiled. Avoid eating late at night because it is easy to increase blood sugar the next morning. Some of the advertised prepackaged foods may not be appropriate. Eat enough nutrients. Nutrients that will produce energy are an important source of vital activities, bodily movement, and energy is expressed in kcal. Foods containing glucid, protid, lipid are the main sources of energy. Starch, glucid. The acceptable ratio of calories to carbohydrates is 44 to 46%. The average person is 65% of the total energy of the diet. Blood sugar tends to spike after eating, so the basic thing in a patient's diet is to limit the use of foods with a high glycemic index, but not too much so that the body can still function. Maintain normal weight and activity. In one serving of glucid 200 kcal, equivalent to 1 cup of rice, 1 loaf of bread, 2 sweet potatoes, 1 corn, 4 slices of sandwich, 200 grams of fresh vermicelli, 2 bowls of porridge, 200 grams of cooked spaghetti noodles. Protein, protid. Protein intake should reach 1 to 1.5 grams per kilogram per day for adults. Diets with too much protein are not good for the kidneys. For those with diabetic nephropathy, with albuminuria and/or reduced glomerular filtration rate, the recommended daily dietary intake of 0.8 grams protein per kilogram per day should be maintained. However, the amount of protein in the diet needs to be higher than that of the average person and should reach 15% to 20% of the dietary energy. The average person is 12% to 14%. It is recommended to use a combination of both animal protein, meat, fish, eggs, milk, with vegetable protein, sesame, beans, to reduce the price of beans and peanuts with lower glycemic index. In one portion of protid 80 to 100 kilocalories, should only eat 2 to 3 servings of meat per day. Equivalent to 1 piece of fish 50 to 80 grams, 100 grams squid, 1 egg, pork, chicken, beef 50 to 60 grams, tofu 100 grams, 1 medium crab 250 grams, shrimp about 150 grams. Reduce the risk of death by eating fish 1 to 3 times a week. According to the results of 20 studies conducted by the Harvard School of Public Health, eat fatty fish such as salmon, herring, mackerel, and mackerel. Sardines 1 to 3 times a week reduces the risk of dying from heart disease by up to 36%. Fats, lipids. In the diet of people with diabetes also need fat to provide energy, compensate for the reduced amount of energy provided by glucide. Eat saturated fatty acids found in seed oils, soybean oil, sesame oil, sunflower oil, etc. The ratio of calories to fat should be 20 to 35% of total energy intake, 18 to 20% for the average person, and should not exceed 35%. Limit saturated fats, animal fats, and processed fats, margarines, cooking oils of chemical origin or fried and then reused, because they easily cause atherosclerosis. Green vegetables. Vegetables and fruits are one of the most commonly seen dishes and play an important role in supplementing natural sources of vitamins and minerals to help the body improve resistance. These ingredients are often found in fresh fruits and vegetables. Eating more fiber will help you feel full faster, which in turn can reduce portion sizes, leading to weight loss. In addition, one type of tuber is also very good for health, such as broccoli, bitter melon, onion, cabbage, cauliflower, spinach, lettuce, carrots. And carrots have high beta-carotene content. Very good blood sugar control. Carrots also work to slow down the metabolism of blood sugar, reducing blood sugar more effectively. Consumption of salt. Goal. Salt intake is less than 2,300 milligrams per day. The vascular endothelium of diabetics is very sensitive to salt compared with normal people, and the risk of hypertension is increased when using a lot of salt. So people with diabetes should limit salt, consume less than 2,300 milligrams per day. Further reducing salt intake to about 1,500 milligrams per day may be beneficial in lowering blood pressure in some cases. Fruit. The sugar in fruit is the type of sugar fructose. Fructose sugar raises blood sugar more slowly than sucrose, cane sugar, so people with diabetes can use it. Eat dark-colored fruits. Dark-colored fruits often have a variety of vitamins and minerals essential for heart health and general health. When you have eaten fruit, you should reduce the amount of starch in your daily meal with an equivalent dose. Absolutely do not eat fruit to replace other foods. Note that you should not use fruit juice, then lose the amount of fiber in the fruit, causing blood sugar to rise. Sugar itself, whether it is fruit sugar or cane sugar, increases blood sugar levels and increases the concentration of unhealthy fats, increases triglycerides and lowers HDL cholesterol, so it should be used in moderation. About 10 grams 1 serving of fruit, equivalent to 1/2 apple, 1/2 pear, 1/2 orange, 1/2 guava, 4 grapes, 4 lychees, 4 rambutans, 1 slice of grape, 1 centimeter, papaya or pineapple, watermelon. Milk and dairy products. People with diabetes can still drink milk and use dairy products. However, it is recommended to use unsweetened milk, or milk that is specially formulated for diabetics. Eating a cup of unsweetened yogurt before a meal can reduce the absorption of carbohydrates and cause less postprandial blood sugar spikes. Should give up the habit of drinking milk before going to bed. You can drink milk in the morning, breakfast, or noon. On tired or sick days, canned milk can be used to replace meals, with equivalent energy. In addition, you can eat porridge, noodles, or bread that are cheaper and easier to find. Food should not be eaten, limited. In addition, eating foods such as offal of animals, processed foods such as hot dogs, sausages, chilled meat, also contribute to health effects. Some types such as soft drinks, sugarcane juice and sweets should only be used for emergency cases of hypoglycemia.